I'm Ken Cutler, your Nevada County Public Health Officer, here on May 6th with an update about COVID-19. So in Nevada County, we've had 41 people who have laboratory confirmed infections with COVID-19. You can always find updated information at mynevadacounty.com/coronavirus. And what you'll see there is that we also have posted the age groups of people who have been identified with COVID, and whether they live in eastern or western side of the counties, because you'll see that there's some difference there. We also talk about following active cases. That means people that are at home in isolation or in the hospital, and we're checking on their status, checking in with them until they're released from isolation according to Centers for Disease Control guidance, which is currently that if somebody has an identified COVID-19 infection, they can be released from their isolation after they've had no fever for 3 days, and that's without a fever-reducing medicine, that their respiratory symptoms have improved for 3 days, and that it's been at least 10 days since the onset of their symptoms. Which brings me to the next point, is that we anticipate that the number of people with laboratory-confirmed COVID-19 will go up as our ability to test goes up. OptumServe site in Grass Valley started yesterday. They have the ability to see over 100 people a day by appointment. And so that greatly increases our capacity to test people, both those who have symptoms, and in the past it's been harder for people with mild symptoms to get tested, and then certain people who don't have symptoms but are in higher risk settings. They're in essential services, essential employment, they've been healthcare workers or first responders and want to check on their status. So that's available as well. Plus, we've worked in concert with our partners in Placer County to make sure that they have a site in Kings Beach accessible to those Nevada County residents on the eastern side of our county. As we anticipate more laboratory confirmed cases being identified with the increased ability to test, we also have really increased our ability to contact those people, have them isolate so they're not spreading the disease, and also interview them about their close contacts so they can be quarantined and monitored. And so the staff has been trained on that. We've brought in extra people. As those numbers go up, we'll expand accordingly. We do recommend that people use cloth face coverings when going out. We want people to stay home as much as possible, really go out only for essential services. But there are times when you go out where it's harder to maintain that 6 feet of distance. People have been doing an excellent job at helping us decrease the transmission of COVID-19 in our community by maintaining physical distancing, washing their hands, disinfecting surfaces, etc. But one thing in addition to that that we do strongly recommend is that you wear a cloth face covering in the appropriate way. So that means that you wash your hands prior to putting it on. You hold it by the ear loops or bring it up, not in an area around your face. You put it on and you re-wash your hands. If you inadvertently touch it unintentionally, please wash your hands again. And a reminder that having this shouldn't prompt you to go out more than you were in the past and shouldn't make you feel more secure getting closer to people. When I wear it, I help protect you. When you wear it, you help protect me. So I'm encouraging everyone who can wear a mask to do so. We don't want children under the age of 2 to wear them, and sometimes people have been advised by their doctor because of either breathing or other difficulties that they have with masks not to wear them. But for most people, when you go out, please cover your face. As many of you have heard, California as a state has been under the stay-at-home orders. Those are still in place. But California is going to move from stage 1, which is where we're at now, which is people leaving homes only for essential services, to stage 2, which will allow limited increase in retail abilities with curbside pickup. Those will be sporting goods stores, bookstores, retail for clothing, And as we progress with that, we'll also start looking at ways to increase in a safe and gradual and incremental way where more businesses can reopen.